Welcome back, class, to CPR, first aid, and AED utilization. Today we are moving on to our second part of all online course. Previously we had covered injuries to the extremities, and we've learned that some of those can be very much detrimental to the person, where we're going to call 911 immediately. There are ways that we can help them with splinting, with utilizing that fun little triangular bandage that we had here. You know, we can go ahead and make that toga shape, remember? Put the arm in there, wrap over the top, and secure it in place. Go to that video to check that out some more, but we need that. We need our gloves. We need to take care of ourselves. I got this little kit right here. It's a little fun one here. I just took that out separately. I have these sometimes. You can always purchase these online then too. This is just a simple student kit that if you want to keep on practicing and utilizing something over and over again, if you're going to contaminate it, right? This is a good little combination. You got a face shield. There are 2 woven sponges. There is, or you could say gauze. There's latex-free gloves, and there's a roller bandage all in here in this little kit. So that's something I like to keep with me. Again, like I said, a few things like those, plus adding some Band-Aids, and you're cooking pretty good. Something else that we're going to use today, so make sure you have these out sooner or later today. We're going to have a roller bandage. We're going to have some plain gauze if possible. Now, you don't need to use these today if you want to keep yours clean. Go ahead and just pretend with a piece of tissue. Toilet paper is fine for now. I know those are in precious need right now. But you do have a roller bandage, so go ahead and pull that out of your kit. We can go ahead and use that for safe practices. Now, if you are going to go ahead and do that today for the first time, you don't want to contaminate your current gauze that you have. Wash your hands really good, like our protocol of 20 seconds beforehand, before we start class. Pause this video, go ahead and do that, and then we're going to use this later on ourselves. So we're going to practice wrapping some wounds. Some other things we're going to do, so we're going to practice the wound wrap. We're going to cover external bleeding for some of those aspects, how we'd wrap them, whether it's a figure 8 or using a dog ear to hold that in place better if we don't have a lot of security, like tapes around. Maybe things are wet, right? Other things then too, we're going to work with the elastic bandage. Now if you have one of those, awesome, get it out. I'm going to show you though how to use one of these because it applies pressure for you. With that being said, we will continue from extremities now into injuries to the head, the neck, and as well as the spinal cord. Now, here's a little quick question. What age group would you people think would be the age group that gets the most head, neck, and spinal cord injuries? Okay, let's go through age groups. Let's go through, all right, is it kids, ages 0 through, let's say, 14? Is it ages 15 through 30? Or is it more in the later years of our lives? Maybe, say, 45 through 55, 60 years old. And let's go to the elderly. Let's say 90 through, whatever it may be. Well, we're going to find out that the most head, neck, and spinal cord injuries are actually going to be from kids, or not kids, but males in the 15 to 30 age range. So 15 to 30 age range, what's going on most of the time here, okay? We have things like, first off, motor vehicle collisions, right? Your driving age, you're learning how to drive still, ages 15 to 30, more common, you could say, of head, neck, or spinal cord injuries and motor vehicle accidents. Other things are falls from just everyday life. Sports injuries are very common, of course, right? Playing football, other contact sports. And then we're looking at other things like acts of violence. Those are sometimes common when you add drugs and alcohol into the situation. So we're looking at, again, like I said, motor vehicle collisions, falls, we're looking at sports, and we're looking at other violent acts. So we could see one of these in a violent act situation. We could be an attendee to a social gathering, a pub, and there's a brawl and somebody could hit their head on the ground, right? Head, neck, or spinal cord injury. Or we have something as simple as you are out back, right, watching some kids play in the backyard. One of them falls playing tackle football and hits his head on the ground. Head, neck, or spinal cord injury. We gotta figure out what we're gonna do in the heat of the moment. Just a little fun for facts number, nearly 2 million Americans suffer a head, neck, or spinal cord injury every year. And those are ones that actually only are reported for medical care. So the number's probably a lot higher. Now the tissues, okay? We learned this a long time ago. The tissues that are gonna be affected, we're looking at the bone, right? Looking at the skull, the vertebra, as well as even the clavicle, we could say, bones that help secure the musculature up towards the skull. We're looking at the brain tissue itself. We have the layers that we have talked about before with the body cavities. So we do have a body cavity surrounding the dura mater, it's called, around the cranial cavity. That's going to help protect the brain. but underneath we have the softer tissue as the brain. And then last but not least, we have the spinal cord connecting the brain down the spine to the appendages for the nerves. We want to treat every single version of a head, neck, or spinal cord injury first and foremost as being more than likely severe. Meaning that we're going to go to the victim, making sure the scene's safe. We go to the victim, tap the victim gently and say, "Are you okay?" And if there's no response, right, like usual, we call 911. If the person is responding, you want to keep them in the most stable position possible for the time being until medical care arrives. Now, if it's something where we can deal with and we figured out that it's not serious, right, we can always delay that 911 call. But again, we're going to look to find these telltale serious reasons on why we call 911 right away. So we're going to see right away, okay, what's the problem? So we'll check the scene. That's our most important thing because that can tell us a lot. First off, right, if the victim's unconscious, we're going to have to survey and figure out what happened in that situation. So I'm just going to throw this out in your mind. You could be standing on the street and you could see a motorcycle accident happen. Somebody gets thrown from their vehicle, or maybe you just heard it from the distance. You look around for clues as to what could have hurt, what could have happened. If somebody's unconscious, right, we first want to know, are they wearing a helmet or not? A helmet is going to help, increase their chances of survival versus not a helmet, right? Now we more likely have a head, neck, or spinal cord injury. We got to get this person immediate attention. Moving back to the helmet, we'll get to that a little bit later on with something. We're going to look for broken parts, right? But we're never going to want to remove that helmet. Because if we remove that helmet and that person's laying on the ground, that helmet's providing like a 3-inch cushion for their head to fall down to the ground once you remove that helmet. So you can only aggravate a head, neck, or spinal cord injury if you choose to remove that helmet and the person's not conscious, not complaining of injury, any serious injuries, right? If this is serious, we want to keep everything as perfect as possible. We're going to maintain stability in that situation. So where the head is found, we'll hold in place. Other things though that we're going to look to, okay? Was there like a significant force that happened? So did the person just fall, or did they collide into something, right, and fall? Okay, we want to look for broken material, like I said, from the helmet, or strewn glass, or something like that from a motor vehicle crash. You want to look for if the airbag deployed in a car crash, if the person was wearing their seatbelt. We're going to want to look for things like, wet terrain, if they slipped, and that's the reason why they fall. But there's so many possibilities we could really go on forever. But when we're at that scene, right, we're making sure we're not getting ourselves injured, and we're making sure that we're figuring out clues that that person is unconscious and there's no surrounding peoples to indicate what happened. If we can have somebody talking, great. We can have a lot of help with that situation, figure it out. Other things, though, we want to look for, right? Maybe the person is unconscious, but they're not fully alert. Good reason to call 911, right? They're not all there. Another thing, they smack their head off the ground, they get up. You ever seen a football player do this before? They don't walk exactly straight towards the path to where they need to go to the huddle. Maybe they zigzag a little sideways and then they try to make their way over there. Obviously, you can tell sometimes people, when they get concussed, they're not all there. We want to go ahead and seek some help there. We want to sit them down, find out their symptoms, and then decide whether or not it's a good situation to call 911, or at least get the right people in there to help them out, get them to the hospital. Other things, though, if the person maybe that look of coming in and out of consciousness, or maybe they're walking around and they're kind of like coherent but not really there, maybe they almost seem intoxicated. That could be a good symptom. They look intoxicated. Other people then too, for people that take falls, we're looking especially to elderly because they got a lot farther distance to fall, and then they also have brittle bones. So if they're frail and they took a large spill, yeah, we have to worry about a hip injury possibly, but we've got to worry about, could they catch themselves to stop their head from hitting the ground, okay? So we have to look for symptoms. Sometimes with children, especially with 3 years or younger, if there's evidence of a head, neck, or spinal cord injury, you want to treat these as very significant as well, because right, their development, we want to ensure that everything's okay before we send that kid out doing something else. I'm going to keep moving forward here. Signals, okay, so we had signs of the scene, a little bit more of what we could see first off. Now we have signals of the person themselves. So the first things we're going to look for, if we visually see something swollen or something bruised, This is where the palpation comes into play. So, right, you put on your rubber gloves, non-latex, and you have consent, right? You're palpating gently because you see nothing else going on, no other signs of injury, no blood, but you're looking to feel for a bruise or something going on with the skull. If you are gently palpating on both sides of the skull around the head, so imagine the person's body is, their head's right here in front of me and their legs are laying away from me. I can stabilize their head in this position right now on either side of their ear, and I can gently palpate around the skull, right, to feel for any kind of abnormalities, something abnormally shaped. You can sometimes tell if there's a bruise. Sometimes doctors even miss things every once in a while in the ER. So if you were doing a little thing right away just to help them with their job in the first place, this will go a long ways. Hair can hide a lot of blood, especially when people wear dark or have dark hair. So we're going to want to move the hair gently and softly just so we can see where the extent of those wounds could arise or end up. There could be a wound on one side of the head, another wound on another one that you maybe didn't even notice at first. So do comb through gently with your fingers, soft. Pain could be severe, right? There could feel like there's a pressure in their head. That's a sign that they whacked their head pretty good, and there could be pressure of blood actually within the brain cavity. So that's something, right, very severe, something we want to make sure we're calling 911 for right away. With other portions of the pressure, sometimes because of the head hitting so forcefully, there can actually be a accumulation of blood around the eyes, or what we could say is the sinuses of the skull. Sometimes when people hit their heads, they'll be bruising here around their temples. There'll be bruising here around their eyes. Those are significant signs that there's bleeding then into cavities or other places. So it's a good idea to get that person some medical attention. If at any time we were to ever see fluid coming out of the eyes or fluid coming out of the ears, 100% reason to call 911. Keep that person stable for the time being until medical help arrives. If the person has any kind of tingling or loss of sensation to their extremities, yes, we call 911. We keep them right in the position we found them. We do not move them at all whatsoever. Head, neck, or spinal cord injury, 101. We don't move anything. The main thing that we're always concerned with, right, is the neck first and foremost, that it's in the position we found it, maintaining the stability and alignment where that is. Mainly because right here through our cervical spine is where all of our nerves start to branch forth, run towards our arms. Okay, we actually have what's known as a brachial complex that runs off, starting at the cervical and down to the thoracic nerves. So what we want to make sure is that this is very much stable, because this is critical. This is what's sending all the information to the extremities, down our torso, down our arms, down our legs. It is pivotal that we keep the person in the most stable position possible. That's us physically going down next to their head and holding it stable in that position and not moving a muscle, and holding it there until medical help arrives. If that person awakens, right, we gotta have to go ahead and make eye contact with them and say, hey, sir, ma'am, whoever it could be, I'm certified in first aid. You've been in a horrible accident. I want to keep you safe here. Everything's going to be okay. I'm going to get you through this. Tell them your name, right? Get their name from them. Ask them some questions. Try to keep them calm. Other things we want to look for, right? Unusual bumps, as well as depressions other than just the swelling areas. We want to look for other kinds of partial movement loss or complete movement loss. So that's why it's good when we're doing with a child, right? We do the toes to head check. Have them wiggle their toes first, and then try to move their knee, try to move their fingertips, move their arms, slowly back upwards. Take your time. Sudden memory loss, that could be a thing. Maybe they have absence of what happened. That's a good telltale that there's been severe head, maybe blunt force trauma. And again, back to the fluid, that's always a key reason to call 911. If you see fluid, look in your booklet. There's actually some good pictures in this chapter on head, neck, or spinal cord injuries of what it looks like they have bruising behind the ear, and then also between the eyes here and the sinuses. These are some of the symptoms the person could be having now. Okay, so first off, pretty obvious, right? We got something like external bleeding. If we see external bleeding, that's definitely a symptom that there's been a serious wound. We're going to want to put direct pressure on that wound, assuming, right, it's not a skull fracture. If it's a skull fracture, we have to ensure that we put pressure around that area with the gauze, right? Not direct pressure straight onto that wound, because we don't want to push any bone fragments up against the dura mater of the brain and possibly cause a puncturing, right, of the brain cavity. We want to keep that safe as much as possible. If the person is having seizures, right, and they don't have a seizure disorder, great reason to call 911 for. If they have trouble breathing, right, impaired breathing, or they can't see, maybe their vision's off, they have uncontrollable vomiting and nausea, any kind of nausea symptoms. Their headaches just constantly does not go away, it's just blistering. They can't balance, right? They are not walking straight, they can't even stand upright. All good reasons, all signals that there's been something severe that has happened. We want to, like I said, make sure we determine whether or not to call 911. More than likely than not, with these severe injuries, right, we're looking to call 911 first and foremost, get them on their way. So while we're waiting for the EMS, okay, while we're waiting for them, we want to go ahead and just, like I said, stabilize the head in the position found. Never remove a helmet from the person. So if they're wearing a helmet, right, we don't take that off. Even if it's a little bicycle helmet or skateboarding helmet, we keep those on intact because that can be helping their head, right, stay stable in the position found. So we just maintain position on either side of the skull, right, really like right here by the ears. What the key muscle that we're trying to deactivate is called the sternocleidomastoid, and it runs from the sternum. Sorry about that, baby boo. Little turd sometimes. We're looking at the sternocleidomastoid. So the sternum, right, and the clavicle form the start of this muscle, sternocleido. And if you turn your head and look down, you can see it pops up. It comes straight up your neck and up behind your ear to the mastoid process. So if this muscle, right, is deactivated, you can't turn your head and you can't flex your neck. So if you hold that person in this position right here on their jaw, or really right at the back of their ear, that little bump you feel, now they can't turn their head side to side. Now they're less likely to go ahead and turn their head and tuck their chin in. It keeps their skull in alignment with their neck. So we want to hold them in the position found, right? Maintain the alignment, the place to hold right there on either side of the ear. We're also, since we're doing that, right, we're technically trying to maintain that open airway. So we want to, right, make sure the person's breathing. We can feel with our finger. We can actually go ahead and palpate, right, or physically put our ear right by their mouth to tell first and foremost. But those are some of the basics, right? We go ahead and check the person, check for breathing, open the airway. If there's breathing, we maintain manual stabilization. We go from our normal position to looking down the body and checking to we move over to the side of the person and hold their head in the position found, straight above them, looking down at them. Other things that we're going to look for then too, we're going to want to try to control any kind of external bleeding in the meantime, right, while we're waiting for EMS to respond. So again, with those obvious skull fractures, we don't put direct pressure on the wound, we put pressure around. For external bleeding, where we don't have to worry about that, direct pressure on that wound is going to be very much well applied. Oftentimes, head wounds can bleed a lot more significantly than what they really are. So don't let that amount of blood possibly make you more fearful that it is bad. We're going to want to just put pressure on it if it's not a skull fracture, and hopefully it'll help. Anyway, continuing forward. If there is ever a penetrating object, we go ahead and leave in the position found. So if you're in that situation, look up the movie Happy Gilmore, and he's talking about all the different jobs he did. He's got a staple gun and he shoots it, or it's not a staple gun, it's a roofing gun, it's a nail gun, and he shoots it, and he shoots a guy, and it goes through his helmet, it sticks him in the head, right? To get that out, they'd have to remove the helmet, right, as well. So it's kind of funny, but in real life, that would be dangerous. We do not try to remove the helmet or nothing. We call 911 right away. We can do manual stabilization while the person's seated. So like I'm seated right here, you can stand behind me, right, and just take your hands and just hold it on either side of my head here and just stabilize my head in the position found. But lying on the ground is the best way to do this because the person's already there, right? We're having them in the position found and maintaining that position. So again, look to your booklet. There should be a picture of both of these aspects. The person, the biker, holding the other biker's head on either side of their helmet, not removing the helmet. Remember, we maintain this position until EMTs arrive, or the person becomes conscious and says, no, I don't need help, right? Or the person stops breathing. In order, we have to perform CPR and utilize an AED even, too. So those are key reasons. Do not try to ever realign the head and the lower body, right? We're going to maintain the position the body was found in. Sometimes we're going to need to move that person, or sometimes you're unable to open the airway right away because they're laying on their stomach and you have to roll them over. That's when we use those previously done physical tasks of rolling the person from that modified Haynes recovery position, I remember that, and then back onto their back. That's going to be into their supine position. So if we're going to do so, right, it's great if we have 2 people to do this job for us. We can do it by ourselves, but it's going to be implied that we are doing the best care possible by, right, maintaining the position of the skull in alignment with the neck. So we're going to have to hold on either side of the back of the neck while we roll that person towards us, cradling their body. Remember from class how we did that? We'll practice again, I hope so, once we get back sooner or later. But hey, Haynes recovery position, right? We're going to have the person on the belly. We need to roll them onto their back. We do that properly and do it slowly. Now, if we have to roll them onto their side, and we have 2 people, this is going to be really nice. With 2 people to do this, we can have one person do the rolling of the body, right? Where we go ahead and when they're laying flat, we put one leg up at 90 degrees. We put the arm up above their head and we roll them over their side, right? Well, now we don't need to do that. We can go ahead and still roll them to their side, but we can have the other person maintaining the skull position in alignment with the rest of the body. So what I'm trying to say is, your book has a good picture of this, rolling the body. The person that's performing manual stabilization is going to be holding the person's skull and then rolling their head in the perfect pace and perfect alignment along with the rest of the body as the other person rolls the person. So timing is going to be pivotal with this. You need to be in communication with the other person who's talking with you about how we're going to do this, right? We're going to roll this person together at the same time. One person's going to be rolling the body while one person's rolling the head. The person that has the head, it is crucial that you maintain moving the body and the head at the same pace. And then when you roll the body back over to the side, same pace as well. We need to make sure that's constantly in position. You never let go of maintaining that head, neck, and spinal cord alignment. So you're not doing your job if you quit that. Maintain that at all times. So 2 persons, great. Other life-threatening conditions, right? We're checking for those things then if we can't tell what's going on besides those other signs. If the person's not breathing right, we're going to have to go ahead and give the CPR. We never withhold CPR. That's going to be something we always give. If there's no breathing, no circulation. So that's a case when we have to discontinue maintaining the stabilization of the skull. We have to move to the side of the body and continue forth with our normal progressions of our 30-to-2 ratio of CPR, 30 compressions, 2 rescue breaths. Doing that 5 times, right? 2 full minutes, and then checking for 10 seconds for signs of life, continuing forth if we need to. Even applying an AED if we have one, that would be great. Now, if the person vomits, right? Head, neck, and spinal cord injury. This is where we have to maintain that skull alignment. We roll them onto their side in the Haynes recovery position, let them vomit, clear it out if we need to, and then roll them back onto their back as gently as possible, maintaining that alignment of the neck, right? This is only the most serious condition possible, so that could happen. Let's see here. Oh, a couple things for that external bleeding. Now we're looking at the neck up to the skull. So we already said one, we don't put direct pressure on an open fracture that we see. Maybe there is an open head wound going on, right? And we see that the bone fragments or there's a hole in the skull, right? We don't put direct pressure on that. We put that pressure around it. What we do not do is we do not apply direct pressure around the neck, right? What we have right here is the carotid arteries. And the carotid, there's a split from the common carotid. And that split goes from an internal and an external carotid. And these arteries are going to send blood up to the skull. Now, if we put too much pressure at the split, there's a carotid sinus here, which is a pressure sensor. And if we overpalpate both at the same time, this could cause drastic changes in a person's blood pressure, and they could possibly pass out. So we want to ensure that if we do put pressure, it's only on one side of the neck. We do not put pressure on both sides of the neck. This was kind of a common thing back in the 90s for some kids to play a game. So stupid when you're putting pressure on both sides. So never put a bandage around the neck, right? Pretty obvious things. We don't put pressure on the neck. Other things we can do in the meantime while we're waiting for EMTs to arrive, keep that person from getting overheated or chilled. That's going to be a key thing because anytime there's a brain or spinal cord injury, oftentimes that can interfere with the mechanisms that control their body temperature, right? The brain controls a lot of things and that can cause things to shut down. Keep them as comfortable as possible in that time in that time being. No water, remember? Never give them water, no matter how thirsty they say they are. We don't want to cause any disorders outside of what's going on at the moment. For concussions, basic things for concussions, they can be very minor to more severe. Not always is there a loss of consciousness with a concussion. These effects, they could last they could be very intermediate. They could be for a few hours. They could be a few days. The main thing is that the person seems different from what they normally are. At least go see some medical help. At least have them see their doctor to understand what could possibly be going on with their head wound. Common signals for these concussions, because they are more common than other injuries, are confusion, right? Headaches. They could be questioning what happened. They could have memory loss, further even beyond just what happened then, or currently going on. They could have. They could go unconscious. They could be vomiting or feeling like they're nauseous all the time. They could be saying things incorrectly, more than usual, or slurring speech, or using words differently. They could also have light sensitivity. There could be vision problems. So look to all these signals for concussions. Now, if you do deem that is a concussion, these are most likely serious. We'd like to call 911 or get this person to the hospital if we can, just to get them checked out. Because again, this could be very much detrimental. It could not just be there for a couple hours. It could be there for a longer time. We don't want to cause any other further problems. Going into those scalp injuries now, again, just further detail. So concussions now is scalp injuries. There's a good picture in the book of them using these gauze and putting direct pressure. No, I'm sorry. Putting pressure around a wound to hold the bandage in place. So it's a good picture. Make sure you check that out in your book. Even a minor laceration wound on the skull can be bleeding very heavily. Watch the movie Twister, and they're in the automotive center thing when the tornado's coming through and the guy gets sliced by a hubcap, and she just puts her palm right in there and holds pressure. Well, you'd want to be gloved, hopefully, and have these gauze. But we're going to put direct pressure on a slice, but they could actually be bleeding a lot more because there's a lot more thin skin there, so more superficial blood vessels. What I'm basically saying is they oftentimes look worse than what they really are. Let's get that pressure on there, control the bleeding as much as we possibly can. You can use your triangular bandage to maybe put around the head. That's absolutely fine. If you want to use that to add some pressure to a wound, that's absolutely fine. Other things we want to do, though, call 911 if we are unsure on the extent of this type of injury. Cheek injuries, not very common overall, but sometimes, somebody's chewing on something, jabs something in their gum or on their cheek or inside their mouth. We're going to look at some of these things. Examine first both the outside and inside if there is a problem. Like, I'm on movies a lot today, but the movie was called Something About Mary. And this kid's fishing, and he swings back, and Ben Stiller's standing back there and gets caught by a hook in his cheek and gets pulled off, right? So it's sticking through and they're trying to get it out. Well, they're pulling out the wrong direction, right? The direction that something goes in is the direction it needs to continue to get out. So we'd have to cut the line, right? And then feed it in through the mouth, because there's always going to be that barb end. And if that hook's in there, right, no matter how we try to pull it out, it's going to hook and grab. So we have to feed it all the way through is easier with the human, especially. We don't want to cause any tearing of the cheek any more than what's already going on. So get that out if we can with a structure, if it's not, super deep and not causing overly crazy amounts of harm. It's probably better to get something like that out because that's easy for us. So if we're looking at an earlobe, we're looking at a cheek, yeah, we can go ahead and probably get something like that out. Gloves, of course. We're going to want to control bleeding both outside and inside, right? So put pressure on the outside. You might have to take some gauze and put it in the inside of their cheek then too to keep the bleeding down then as well. Those are always very sensitive, so we want to make sure we're also actually gargling then too, and making sure we're keeping the inside of our mouth clean as well to prevent any kinds of infections. Direct pressure should be fine. If there's something embedded in the cheek, right, that's when that we can't get it out, like the hook, for instance. If we can get it out, go ahead and that's fine. But if it's something like a nail, right, we're going to want to pull that back out the way it came. If it's something like a splinter, back out the way it came. If it's something that's larger, something we're afraid to do, right, we call 911. We let the professionals deal with that. Other things then too, nose injuries. Let's move to the center of the face. These are common. People get hit in the nose all the time and they have bloody noses. Some people have frequent bloody noses, allergies and bloody noses, kind of a common thing overall I've seen. I've had many bloody noses in my time, whether it's from sports injuries or just because it was very much a thing with me growing up anyway. What we want to do is we want to have the person sit slightly forward, right? Lean forward a little bit and put pressure on the nostrils themselves. And you want to probably pinch the nostrils together with some gauze So these gauze will work well for about 10 minutes straight would be the amount of time. This is giving the blood a chance to, I'm going to say, quote, dry, right? So that way, with this coagulation, it gives a chance for the blood to actually start clotting like it's supposed to and stop the bleed from happening in the first place. The reason we don't want the person to lean back is because the nasal cavity is going to open up to the throat, and the throat is going to open up to the place of the esophagus, and that can start to drain down into the stomach, or it can start to drain down into the trachea. Either of those cases is a bad scenario. They can upset somebody's stomach, or they could choke. They could inhale some of that blood. That's, all yippy and gunky. I've pulled out stuff like that, long, gunky stuff out of my nose from just having the pressure like that alone. So we want to be very safe that none of this gets thrown into the throat. So we never want to lean them back. We want to always keep them leaning slightly forward, if anything, with their skull, keeping pressure for 10 minutes. If this does not control the bleeding over time, right, 10, 20 minutes, now's a good time to probably seek some medical professional help. If there's an object in the nose, do not ever try to pull it out yourself unless it's something very easily seen. Then you can go ahead and extract that. But if it's something that's stuck up through the nose, we may want to seek medical professional help instead to deal with that. Other things then too, if the person does lose consciousness from blood loss through their nose, right, definite reason to call 911. We want to lay them in the Haynes recovery position and get some help right away. Eye injuries, okay? Eye injuries are very common as well, I guess you could say. A scratch to the eye is something that hurts like the dickens, but usually heals in a day or two. We're looking more along the lines of if somebody gets hit by a ball or something like that, right? And that can cause damage to the entire eye. If there's swelling right to the entire eye, if there is bleeding of the eye itself, the white of the eye looks all bloody. Any of those situations, it's probably, or the person has distorted vision, call 911, right? Get this person some medical help. If there's ever anything shoved directly in the eye, right? We never move it. We never put direct pressure on the eye. We put pressure around there or around the top of it, right? We use a gauze and around the outer edge. We don't want to put pressure directly on it. So pushing on an eye is never good. If the person has a foreign object in the body, or in the eye, I should say, so let's just say it's like some chemicals, okay? We want to flush the eye, right? We want to have them flush that with water. Something easy to do. If there's particles of any kind of chemical or dirt, debris, right? Again, same thing. Flush it out with water if we can. Seek medical care if the object remains. Chemicals, we always call 911. If that object's embedded in the eye, right, we never remove it. That can cause further harm to the vitreous humor within the eye. It's vital for vision. Vitreous humor. Vitreous humor. So vitreous humor is within the eye, and that's very important for our vision, maintaining the integrity of our eye and how the capsule sits. We have other fluid that's replenished daily. That's why we scratch our eye, and it's better the next day or two. But that deeper fluid, if that fluid is extracted, you can go blind. So we never want to pull an object out. We'd rather have the person get their eyes covered, take them to the hospital immediately, or have EMTs do so as soon as possible to help get the object out safely. So shield the person, right? Paper cups work great. 2 paper cups over the eyes, both lead them to wherever you're going. That's one of the easiest things to do because that way, both eyes are going to want to move usually when they see. So cover them, keep them up. Never keep them unattended. Ear injuries, right? You can injure the lobe or something within the ear or deep. We never want to deal with structures within the ear. That's not something for us to do unless we see the object and we can safely grab it. But anytime there's an ear wound, we want to take that object out. If it's embedded, we want to be careful, right? Safe when it comes to pulling. If we're going to pull something out, be careful. So don't use a sharp object. Don't use tweezers. Don't use pointy tweezers. Use like your finger. A gloved finger would be easier to get something like that out if we could, safely so. Other things though too, let's see here. If there's ever some kind of fluid or drainage from the ear, right, we want to go ahead and cover the ear lightly with some kind of sterile bandage and call 911 with any kind of fluid leaking from the ear. That's moving down to other types of injuries with the face now. So there could be a jaw injury. The mandible can be dislocated, possibly happen. So it could be a combination of a concussion as well as symptoms with a hurt jaw because they could have got hit. Right, that's a combination of injuries. But these aren't as serious because this is a free moving bone separate. It could be detrimental long term possibly if there's something going on with the joint, but otherwise normally we can be okay, but again, somebody could get kicked by a horse, they could have broken teeth, broken jaw. Call 911. Those could be considered a serious one. For an object penetrated through the lip, again, we can go ahead and, if the wound is open still, put gauze underneath in the gauze, put gauze on the outside, put pressure on it. Control the bleeding first and foremost. For a tongue, same thing, put gauze directly on it. Try not to move the tongue. Direct pressure is going to be key. Anytime there's swelling of the lips, of the tongue, any of that, we can always use, for the jaw, we can always use an ice pack. Again, use a barrier to make sure they're not getting it too cold. We can always seek further medical professional if we think this is something serious. Since we're looking at teeth again, since I talked about those getting knocked out, we can always, if it's a permanent tooth, not a baby tooth, right? No point in saving a baby tooth. But a permanent tooth, we can go ahead and take a glass and put it in milk, right? Transport that to the dentist with the person. That's going to help. That's going to help out tremendously to make sure that the blood supply can actually come back to the tooth, and it's ensuring that the nerves are protected, that it can possibly still, be fixed. So again, gloved hand, we're going to pick up that tooth, keep it clean, so we can rinse it in water real fast, but then we're going to want to put that in milk. We can clean the person's mouth out then with ice or with cool water. Cold tap water is good enough. Get them to the hospital. You can have them bite down maybe with like a piece of gauze in their mouth, and that just apply some pressure to control the bleeding for the moment being then as well. Back to the jaw again. Like I said, concussion combinations, but if we have a suspected jaw fracture or complete dislocation, something's off kilter, we want to call 911 because we want to make sure the airway's open. That's one thing that could actually cause problems. Or, like I said, fracture too. Fracture is always bad when it comes to the jaw. Anytime the soft tissue injury is to the neck, we can go ahead and put direct pressure right on one side, not on both sides at the same time, because again, that would cut off that pressure of blood up through the carotid arteries. For a large laceration, just apply direct pressure as much as we can with a gloved hand, and then always use more and more gauze if necessary to apply more pressure. I think that's a good place actually for us to stop this week when we're talking about those kinds of injuries to the head, neck, and spinal cord. I'm going to do a little quick run through of a skill for us. The skill is going to be working on how we're going to bandage something, as well as how we're going to utilize a figure 8 wrap. So, if you have your gloves, you can put them on, but you don't need to right now since we're just practicing at home with our loose supplies. I have some of my loose gauze, and I have a marker to pretend draw an injury for me. And I have my roller bandage here. So these are the things you're going to need right now to do this little trick. So I'm going to go ahead and just take my arm here, and I'm going to turn, because most people are right-handed, I'd assume.